Guys, welcome back to Medical Coding with Blue. Today's episode is all about what to do if you want to get back into medical coding after a long absence. And do you need to learn, and how do you get to learn about the electronic health record or the encoder? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, I know that was a little bit of a long-winded title. I will say this up front. It is the end of the night for me, and it's been a very busy day today, and so I'm trying to get this episode filmed and up for you guys. So please bear with me in this episode. This is my 5th take already on this one. But I want to talk about this because it's very important. Thank you to the viewer who sent in this message that inspired today's episode. So here we go. So the viewer says, "Hi Blue, the advice you give has been invaluable to me. My question to you is this. I was a coder with my RHIT, Registered Health Information Technician. That means that this person had their associate's degree in Health Information Technology, and CCS, that is the gold standard of medical coding credentials. That is the CCS, Certified Coding Specialist. Worked about 30 years ago. I left the profession in 1994, and I let my CEUs lapse. I now want to return to being a coder or anything else in health information technology. I am doing your independent study courses, but I don't know how I should go about getting knowledge of EHRs, EMRs, and encoders. Would it be a good idea to enroll in a HEMA's Health Information Technology bundle of courses, or take AAPC's EMR EHR course? How do I get up to date on my computer skills? Also, do I need to sit for the CCS all over again? And can I make my RHIT relevant again? I would very much appreciate your thoughts and advice. Thank you." So, to answer some of the more obvious questions, yes, you will have to take the CCS again, because when the person originally took it, it was during ICD 9 times. We are now in ICD 10. So again, that many years and not keeping up with your CEUs and reporting them and everything, your credential has already lapsed. So that's something that you do have to take again. You will have to take it again. You will also have to call a HEMA about your RHIT, because, you know, I'm sure that has lapsed as well, because while you have your associate's degree, you did not maintain the CEU requirements for the RHIT. So that's something that you're going to have to talk about with them. And calling a HEMA, they have good customer service. There's been some people who say things about the customer service. I, thankfully, knock on wood, have not had any issues with the HEMA customer service, and they're usually pretty well, quick about answering my questions. So I would talk to them about that. But the thing that I want to point out is they asked about the EHR, EMR, electronic medical record, electronic health record, and the encoder. And a lot of people ask me this too. They say, "Well, Blue, I'm brand new to the field. How do I get experience with the EHR, the EMR, or the encoder?" There are some demonstrations I've seen on YouTube, about some of the more popular EMRs. However, I will say that this, out of everything that you should worry about as a brand new medical coder, that's not something you need to worry about. Why? Because when you get hired on, there are some things that the employer is willing to train you on. One is the electronic medical record, electronic health record, and the encoder, because every facility, every doctor's office uses a different EMR, EHR, and encoder. So they use different ones. And even if you have two that use the same, say for example, 2 facilities both use Epic, their Epic is going to be different, because they may have different packages, because Epic will sell this type of package and add this, and you can add this, and you can add this. So sometimes some have a basic package and some have more advanced packages. It really all depends on the needs of that facility. You guys have to remember that the electronic health record, the encoder, the electronic medical record, these are all very expensive. So a facility is going to look at what do they need, what is the absolute most that they absolutely need, and then that's it. For some, you know, especially if they have somebody that doesn't understand what we do and really doesn't understand, but they're just trying to be very conservative with money, you get what you pay for. And so they learn that really quick and they learn about needing to upgrade these packages. But when you do get hired on, that is the one thing that most facilities and most organizations are willing to train new people on, is the use of their particular encoder, their use of their particular electronic health record, electronic medical record, because everybody is different and they know this. The one thing that they are not willing, most places are not willing to do, is to train you how to code. You should not be needing to be trained on how to code as soon as you get hired on, because your credential, whichever credential you get, one of the 4 main medical coding certifications, the CCS, the CCA, the CCSP, or the CPC, any one of these is going to say that you have competence in order to code. If you don't have this competence because you guessed your way through an exam and you just happen to pass, you're setting yourself up for failure. However, I will say there is good news. You can train yourself, guys, with all of the materials that are in the description box below and all of the books that are there. All you have to do is work through the books. And that's what you have to do in order to ready yourself for this industry. That's what it's going to take, guys. It's not going to take negotiation. It's not going to take, oh, I don't want to do this, I don't want to do that. It literally means get in there and start doing the work again. Now, this person says that they're doing my independent study. That's great, because I have gotten feedback here recently already. 2 more people were telling me that they passed their certification exams because they used my independent study. And so I am beyond delighted. It makes my heart swell so much, because it makes me happy and it makes me so proud that these people are listening. And now they have the keys to the kingdom are right there. And all they have to do is keep doing the work and they will be able to get what they want. And there's a lot of people who already are in those processes of doing all of that. So that is really fantastic to hear. But the thing about this whole thing, guys, is that you have to prepare yourself as much with the coding as you possibly can. Don't worry about the electronic health record, okay? A lot of times when you're looking at the job listings, it'll say if you have Epic experience, preferred but not required. And sometimes it'll say Epic experience preferred. Preferred does not mean required, all right? And that's a big thing that you guys got to know. Same thing if they said eClinicalWorks or Cerner or any of those, okay? Any of those big boys. And they say experience is, you know, preferred but not required, all right? So again, that should be low on your list of things to worry about. As far as the AAPC, EMR, EHR course, I don't know. I have never experienced that course, although I will say it's probably just going to be a general introduction to those types of things. And again, that's something that you're going to get training on when you are at your facility. So it's up to you. It's entirely up to you. But that's just going to be an introduction. It's not going to be, oh, this is what you have to do and this is what the electronic health record looks like. Again, because everybody uses the same. Epic is a big EMR, and I have never used Epic. I have never used Epic. My facility does not use Epic. Any of the places I've ever worked has never used Epic. I've used other electronic health records. Again, it goes back to the needs of the facility and all of the people that are bargaining and signing up for these programs. It's all on them. I'm just doing the coding. And the EMR, the EHR, the encoder, these are all electronic tools that help me to do the work, but all the work is up here. I still have to use critical thinking. I still have to use my knowledge in order to select the correct codes and to put the codes in proper sequence and everything. So there's a lot of things that go into it. Again, having your core knowledge of coding is going to take you a lot further than you worrying about, oh, do I need to take this course or that course or this course or that course? Again, it's all about the books. When you get into a facility, then you'll be able to see and you'll be able to know, like, okay, this is what I have to start learning. There's a lot of demonstration videos all over YouTube. Don't ask me because I will not share them with you. You can do that. You can do that research. Just let your fingers do the walking, okay? I do have a encoder demonstration video, and for those of you that get extra sensitive because my videos have commercials in them, that's one of the videos that I do not have any commercials in. So that's something that you can look it up, and you can see the demonstration video for the encoder. But I just kind of go through some of the pathways. Some of the encoders you use may not look like that, but it kind of gives you a general idea, okay? And no, again, I will not give the link. All you have to do is go through my videos, and you'll be able to see the encoder video and encoder demonstration. You can see it come up. So that's what I would say there for that. The other thing is, we talked about that. How do I get up to date on my computer skills? Again, YouTube is a whole treasure trove of lots of ways of getting up to date on your computer skills. There's tons of videos that talk about how to use Excel, how to use Word, and things like that. So if you're looking at those types of things, there's a lot of videos demonstrating different things about those things. Outlook is another one. It'll show you how to use Outlook, some of the features of Outlook. But those are not the things that are going to be like concentrated on when you're in an interview for a medical coding position, or if you're trying to get back into medical coding, okay? That's not what they're going to be asking you about. They may ask you if you can use those, but they're certainly not going to hold a lot of weight on those questions. The more heavily weighted questions are going to be your medical terminology, your anatomy, pathophysiology, your coding questions. That's what's going to count. And as far as your experience, I have always recommended that if you're going to talk about your experience, you want to talk about the last 10 to 15 years. Obviously, 30 years ago, that's going to count all of that experience out. It's not going to count anyway because it's hard to remember what happened 30 years ago, okay? There's a lot of things that went on 30 years ago, you know? And so there's things that you're not going to be able to remember, and again, it's not relevant. So I wouldn't even bring that up. What I would bring up is the fact that you do know medical terminology, anatomy, pathophysiology. Those are things that stay with you. And if you've forgotten a lot of it, it'll come back to you. Again, there's a lot of videos on YouTube. Crash Course is a great and wonderful channel. I was going to say wonderful, and then I said great. Guys, it's late and I am tired. But like I said, I want to get this video out. And the Crash Course videos are going to help you to remember some of that anatomy and medical terminology and all of those good things. And spending the time listening to those. And they're little shorter videos, like 10 minutes. Some are like 13 minutes. And this is just great for getting right back into it, okay? So that may help you to kind of get more confident in that. But that's what I would do. I would hold off on, buying all of these different courses and things like that. Just get through the books so that way you can kind of see what comes back to you. And obviously working with ICD-10 is a lot different from ICD-9, okay? And ICD-10 is much more specific about like the codes and the breakdown of the codes and injuries and sequela and all of these things. So that's something that you're going to have to just study again, just like everybody else. CPT is a little bit more gentler when it comes to the change, because while there has been some updates and changes with CPT, obviously with some of the codes, the general idea is the same, and so evaluation and management did update as far as like they don't have all of the bullet points for like your office outpatient visits anymore. It's going to be more problem focused exam and problem focused history, so that way they can get to taking care of the patient and they can still get those higher levels, unlike before where you had to have a certain number of bullet points for every system and things like that before you could even get to a certain level. So they changed that around. That's very different from 30 years ago. So yeah, this is one of those things. There's a lot of things on the CMS website. If you go to cms.gov, there's a lot of frequently asked questions on there that talks about the electronic medical record and all of these things. There's a lot of things that talk about HIPAA on there as well, things that you do need to know if you're wanting to go ahead and pursue that CCS again. And those are the things that are going to be covered on the exam. You can also look at the AHIMA website, and the AHIMA website has all of the credentials, and then it has the domains of each of those credentials. Now, the CCS did get a facelift. It is a little different from what it was before. There is a set number of questions on that exam now. It's not like before where there was a range of questions, okay? So that's just something that you should know. But there's different domains now, and that's something that you need to review so that way you know what to expect on the exam. At least that's just my advice anyway. But yes, transitioning back into coding, if that's what you want to do, is a great thing. I would recommend not letting your credentials lapse again, all right? So that way you can be prepared for whatever comes your way, and that way you can have opportunities as you want them, and you won't have to go through all of this scramble trying to get back into it and not really know what to do, which I think you know what to do. It's not any different from what you did before. It's just different material as far as ICD-10 versus ICD-9 stuff, okay? That's just my advice anyway. And let's see, I think that's it. You can get almost all of your knowledge and teaching from YouTube. And that's the greatest thing about YouTube, is that anything and everything that you ever wanted to learn about is on YouTube. Literally anything and everything. And I think that's what's great about it. But yes, so that's my advice anyway today. And I know this is a little short. I see the time. I'm trying to think if there's anything else I need to say about this, other than you left the field quite a bit of time ago, so there was a lot of changes since then. But that's all I have for today. But if you are going to study, make sure that you study 20 hours per week. There is no excuse for not studying 20 hours per week, even if you have a full-time job. You will be able to make the time. It's 3.5 hours per day, and you can break that up into 30-minute sessions up to 1 hour sessions. The 1 hour sessions is where you got to stop. After 1 hour, you need to take a break, whether it's 15 minutes or 30 minutes, so that way you can give your brain time to relax. Because otherwise, if you are trying to muscle through and study for long stretches of time, you're not going to be able to recall things as easily. So what I tell people is 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes on your drive home. You could be listening to something. At lunchtime, you could be working with flashcards, all right? It's entirely up to you. There's Quizlet, okay? Quizlet has those electronic flashcards. I really do recommend handwriting out your flashcards, but I get a lot of people who hem and haw every single time I talk about that because they don't want to have to do that. Well, then don't do it then. Don't listen. Don't listen. It doesn't matter to me. I'm not the one who's trying to learn coding, okay? I know coding, and I know how to teach it, and I know how people should learn it so that they can be able to absorb it a lot quicker. But if you want to have your own way and you want to do it only a certain way and you don't want to write things out, well, it's up to you. But I'm just telling you, Quizlet is there, so you can use electronic flashcards if you want to, something to kind of make it convenient for you. And then you come home, you work through your workbooks for 1 hour, take a break, come back to it, work another hour, and that's 3.5 hours you've done in a single day. And you could be listening to things like the guidelines, you could be listening to things about the HIPAA. There's a HIPAA channel on YouTube, and so that way you can listen to things, so you can kind of get that back in your brain, and all of those things will help you, okay? You do 3.5 hours per day for 5 days consistently. That's 17.5 hours if you did that Monday through Friday. And then 17.5 hours, and then all you would need is 2.5 hours on a Saturday or Sunday. And then you have the rest of the time to be with your family, and do all the things that you want to do. So the studying is such a small portion, and it's not going to take over your whole life. The mistake that a lot of people make when they're studying is they think they need to throw themselves into it and ignore everybody. Well, guess what happens when you start doing that to your family and your friends? They start to resent what you're doing. And you don't want that, because sometimes people will start to resent you for spending all this time studying, not spending any time with them. And so they're going to do things because they're hurt and they want to discourage you. And so sometimes people let that get to them too, and then they stop studying coding because their family didn't like it. No, you were neglecting them, and you shouldn't have. You should be taking the time and doing it smartly, 3.5 hours per day. 3.5 hours per day. Your family's not going to need you to be right there in their face 3.5 hours per day. You can have the time. Everybody does their own thing. Everybody does their own thing. Kids will be playing around on their iPad or whatever, tablet or whatever they use. Now, I don't know. I'm not a tech person, but they'll be playing around on that. You could be in the same room with them, and you could be reading, you could be listening to something. Okay, you could be working through the workbooks. Your kids want to help you. They can hold flashcards and they can do drills with you. And if they don't want to do that, guess what? They're going to do their own thing. Okay? So, and this is just granted if they're old enough to be able to do things on their own. Obviously, if they're little, you got to do your parenting duties, obviously. But any other time, guys, you have to be able to make time. Okay? Make time for the things that you know are important. And if getting back into this career field is so important to you, doesn't matter if you're this person who sent in the email or anybody else, if it is really important to you, you will make the time to do it. And like I said, still make the time for your family and your friends so that they don't feel neglected and left out. All right? And they can be supportive of you, because to have a supportive community around you is really important, especially when you're an adult going back to school. You know, there's a lot of people that will say, you know, my family doesn't believe in me. My spouse doesn't believe in me. It's Blue, so I come to your channel because you're so uplifting and you give us that tough love and everything. And I needed that. I needed to hear this because I was discouraged and things. And a lot of people will come here for that, for that encouraging word, even though some people will not hear my message. It doesn't matter, guys, because I know where my message comes from. Right here. This is where the message comes from. And I want y'all to be strong. I want y'all to be able to defend yourselves when you need to, when you're working with doctors who are not going to understand what you're trying to say. And so that's what I want y'all to be prepared for. I want you to be able to defend yourself against senior coders who are not going to understand right away when you're trying to explain to them. You know, this is the reason that you came up with this, and you're trying to show them all of your resources. It's very easy to get discouraged when you have people around you who seemingly have more knowledge than you do. But what a lot of people don't realize, especially new people, is you have a lot of knowledge coming in because your knowledge is new and it's the latest. So, and you don't have any bad habits yet, whereas veteran coders fall into that trap of getting those bad habits. And what do? How do we manage this? Because we're veteran coders and we already know, right? Not always the case. And especially if those veteran coders are not evolved. Sometimes veteran coders, they're not evolved, and they feel like they're always right. Okay? They feel like they know everything. And I will be the first to tell you that I do not know everything, because this is a lifelong learning process. We only get a few months to learn coding, okay? If you're doing it right, 9 months, 12 months, or 18 months. Just to learn the coding part. And we have to know what doctors know, while never having gone to medical school. I said this yesterday, and I'm going to say it again today. We have to know what doctors know while never having gone to medical school. They get 10 to 15 years to be a doctor, and we get just a few months. So again, we have to learn, and so that we can be able to catch up to them. I'm just saying. At least this is the way that I look at it anyway. But yes, make sure that you put in the time. There's no excuse, because if you're only putting in just a little bit of time, 5 hours here, and maybe getting 20 hours in a month in, versus a person that's doing the 20 hours per week and getting 80 hours in of study, there's going to be a huge difference between those two people. The confidence level of somebody who is studying those for those 80 hours in a month versus a person that's barely making it with 20 hours is like night and day. Okay, and you want to make sure that you're that person that's doing this 80 hours, because all that time is going to add up, and it's going to make you more confident. And trust me, you put all that time in, oh, you will be strolling into that test room, the exam room, with confidence, and that's what you need. And all of that, oh, I'm a nervous test taker, all of that flies right out the window, because that's not even going to exist. Being so nervous about taking a test is because you didn't study enough. Or even if you did study a lot, you were trying to cram it into just a short amount of time, and that doesn't work either. I'm just saying. So I'm going to leave that there. But if this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.